Okay, this is my assessment on the chest and lungs and cardiovascular system. I'm going to start by assessing the patient for any signs of respiratory difficulty, inspecting the shape and the movement of the chest wall, looking for symmetrical chest expansion, equal chest rise and fall, and then noticing or observing any abnormalities such as the skin color, bruising, deformities, or surgical scars. And then we'll begin with the neck. And as you can see, his trachea is midline. I don't see any jugular venous distension noted, any JVD noted. Next, I'll assess the JVP. You can do this with the patient's head of the bed elevated at 30 degrees and using a note card and a ruler. And then next, we'll palpate the cervical lymph nodes, noting for any masses or swelling, what size they may be, are they able to move around, is there any pulsations or any tenderness. Did you feel any pain while I was doing that? Any tenderness?
No.
Okay, good. All right, and the carotid pulses are right here next to the esophagus, and I'll lightly palpate those one at a time. And then next will be the brachial artery. Could you raise your right arm up for me, please? And then the brachial artery will be right here. Gently palpate that. And while you're here, notice if you feel any thrills. Thank you. And then you can also auscultate for any thrills or bruits. And the neck right here. And then could you raise your right arm for me again? Okay, perfect. All right, next we'll be moving down to the chest. You can assess here for any tactile fremitus, which would be any vibrations that I feel as I have the patient say the word 99. So if you could please for me say the word 99.
99.
All right, sit up for me straight and say it again right here.
99.
Okay. All right, now we're gonna percuss the chest. So I'm gonna start right here. And then you move down, in a ladder movement. Okay, and now we'll auscultate the breath sounds. All right, so if you could sit up straight for me. Thanks. And then breathe normal, breathe in, out, in. Good. All right, perfect. Next, I'll auscultate the heart sounds, and there's going to be 5 different points that I'm going to be listening for. Okay, you can sit normal. Sorry. All right. And just breathe normal. There I was listening at the aortic valve. That was the pulmonic valve. Next will be the Erb's point. And the tricuspid valve. And then here, in the mid-clavicular area, down to the 5th intercostal, you'll have your mitral valve, which is also your apical pulse, and we'll listen here for 1 full minute. Sorry, I'm going to use my bell. Wrong side. Okay, great. Okay, if you could for me, turn around so I could inspect your back now. Might need you to, sorry. Right. Yep. Okay, we're good right there. Perfect. I'm just gonna move this back a little bit. Okay, so now here on the back, we are gonna inspect the shape and the movement of the back, assess for any shoulder assess for the shoulder symmetry, and then also note the spinal column and make sure everything is in line and intact. You want to also look back here for equal chest rise and fall and observe for any abnormalities again of the skin, any abnormalities of the muscles or skeletal structure. Here I'm going to also palpate for tactile femtitus. So as I place my hands on your back, if you could please say 99.
99.
And again.
99.
Perfect. And one more time.
99.
All right, so now I'm going to be percussing along your back, so you're going to feel me tapping. You don't have to do anything, just breathe normal. All right. So next I'm going to percuss a diaphragmatic excursion. I'm going to have you inhale deeply and then exhale fully and then hold that exhale. Okay?
Yes.
All right. Ready? Breathe in deep. Let it all out. And hold it. For as long as you can. Okay, good. All right, thank you, sorry. Now, what I'm gonna have you do is inhale and then hold your breath, do not let it out, okay?
Yes.
Go ahead and inhale for me. Perfect, okay, there you go. You would note the difference in the inhale and exhale where you heard the sound changing from resonant to dull. And it should be about a normal 3 to 5 centimeter normal excursion. Next, I'm going to auscultate your breath sounds. Sorry. Okay, so could you breathe in normal? More right here. Okay, perfect. Last, I'm gonna listen for certain sounds, but I'm gonna have you say a few things for me. Okay, so on my command, this first one, I'm gonna need you to say E as long as you can, as I auscultate 4 different areas. Okay?
Okay.
All right. Ready? Go ahead and say E.
E.
Perfect. Okay. You can stop. Sorry. Okay. Next one. Go ahead.
E.
Okay, good. You can stop. One more time down here.
E.
Good. You can stop. And then right here.
E.
Perfect. All right. This next one, I'm going to have you say 99 normally.
Okay.
Go ahead.
99. 99. 99. 99.
Okay, perfect. And now I'm going to need you to whisper 99.
Okay.
Could you do it 2 more times for me? Okay, thank you so much.